Speaker, my question is to the Minister of Health and Long-Term Care. Speaker, last week I questioned the Premier about a life-changing therapy for cerebral palsy patients in the province and the barriers created by this government to access the surgery. Later that day, the government decided to approve the surgery costs for Madison Ambos in St. Louis. While we're happy for Madison, there are many other children waiting for support from this government on the already approved treatment. Speaker, will the minister cut the red tape in his ministry and approve the other children who are awaiting surgery today?
Thank you. Minister for Long-Term Care.
Speaker, this is a critically important issue. Access to the highest quality health care, in this case specialized surgery for individuals, generally cerebral palsy children that can benefit from this surgery. That's why it is an OHIP-insured procedure. We also rely on clinical expertise of specialists in this province to make that determination whether or not the individual will benefit from that particular procedure. That's what we've done. We've received thus far, I believe, 17 applications for out-of-country care. Of those, 4 did not have the support of their attending specialist. I believe 2 are still under consideration, and 10, perhaps now 11 out of the 17 have been approved. And those individuals have gone for their surgery or are in the process of preparing to go for their surgery in the United States. So this is a good example, Mr. Speaker, I believe, where we have a system that is working effectively. I understand there do remain certain challenges, and I'm working hard to ensure that our clinical experts are able to provide this care.
Thank you, Speaker. Back to the Minister. Speaker, I have over 21 names here of children who are lost in the bureaucratic nightmare this government has created. And unfortunately, with this government, the only way to get access to services is to raise it in the legislature. So, Mr. Speaker, what is the government going to do for Benjamin, Alessandro, Maya, Athena, Lee, Griffin, JR, Nathan, Sonia, Davy, Ethan, Sophia, Taylor, Tegan, Leela, Bentley, Morgan, Brooklyn, Aiden, Chino, and Ben? Their names are on record now. Will the Speaker act and do the right thing and get the surgery for these children?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Well, Mr. Speaker, it appears that the member opposite has recently obtained his medical degree. Mr. Speaker, we need to leave it to the clinical experts to make these determinations. Virtually 100% of the time where an application for out-of-country surgery is made to the province of Ontario with the support of the clinical expert, that application has been approved 100% of the time, Mr. Speaker. Yep. We have 2 clinics in this province, one in Hamilton, one here at Toronto. We're also working with Sick Kids in Hull and Bloorview at the possibility of establishing the expertise to actually perform the surgery here in the province, Mr. Speaker, to provide that service not in another country but here in Ontario. So we have a process. I know the member opposite is wondering how long that takes. It's important, Mr. Speaker, that it's an evidence-based decision. We work with their clinical experts, but 100% of the children who have come forward with the support of their families, with the support of their clinical experts, have been given the opportunity for that surgery.